Hello, I'm Dr. John Heather and I'm a GP in Weston-super-Mare. I'm sure if you're a resident of Weston, then you've probably heard about Pier Health Group, but you may be wondering what exactly Pier Health is all about. When you hear the term Pier Health, it can mean one of two things essentially. Either it's the super partnership that we've created to be the organisation that represents the 8 practices within Weston and the surrounding villages, or else it's the primary care network, or PCN, that we've also created to represent those same GP practices, but as a result this time of the government's latest initiative to improve funding into general practice. Regardless of whether it's the super partnership or the PCN, Pier Health is always about the same thing, and that's to promote better collaboration between practices, so that in the end we can end up offering better, high quality, consistent and resilient services to patients. It also helps that other partners in the health and social care system now are able to talk to just one organisation. So whether that be Serona, our local community provider, or the hospital, rather than having to talk to 8 different practices, they can simply talk to one organisation. It may be that you're thinking, well, that's all well and good, but how does that actually impact me as a patient in Weston? So I want to talk to you about one of the services that we've just started in the middle of August, and that's our first contact physiotherapy service, which we're running in conjunction with an organisation called Pure Physio. A first contact physiotherapist is a physiotherapist who doesn't treat you, but who sees you, talks to you, assesses and diagnoses you, and then provides a comprehensive management plan. And they're called first contact because ideally they see you before you even get to see a GP. Since the middle of August, we have 4.25 whole-time equivalent physiotherapists working in Pier. That's about 165 hours a week. We've had one of these physios working in Graham Road and Horizon since January, and the feedback from patients there has been that it's been fabulous. And already we're beginning to find the same sort of feedback coming through from other practices. As a leader in Pier, I hope that this won't be the last such initiative. One of the things about PCNs is that they are very strongly funded by the government, and a lot of this funding comes in the form of additional money to pay for extra staff. Indeed, by the end of this present funding round, that is March 2024, Pier Health will have annually an additional 2.5 million or thereabouts of money to actually pay for extra staff. So depending on which sort of staff we recruit, that's an additional 40 to 48 staff across the whole of Pier. That's significant, and that will improve services. So watch out, because good things are happening. Thank you.